Hi, I'm Dr. Ginevra. Welcome to day 22 in 30 days of my Fibro life, which is actually stretching into a bit more like 40 days of my Fibro life, because I'm finding keeping up with the once a day videos for 30 days a little bit challenging. I will say that. So today I'm coming to you from my happy place, my backyard, and I wanted to talk about the 3 different types of fibromyalgia pain and how to address each of them differently. And I will say as a caveat, there's actually a 4th type of fibromyalgia pain that I'll give you a clue as to what that is at the end of the video, and then I'll talk more about it in other videos. But to start, I'm going to show you this image from chapter 19 in the Fibro manual, and it shows what I consider kind of the 3 main types of fibromyalgia pain. And so, muscle pain and tenderness, we're all very familiar with that. The all over body aches, the flu-like aching, also very familiar for anybody with fibromyalgia. And finally, the kind of pain hypersensitivity, or another way to think about it is things hurting that normally shouldn't. They wouldn't hurt somebody without fibromyalgia. Things like our bra strap or, the pressure of a blanket against our legs. Normally, that's not enough pressure to generate a pain signal, and a healthy individual, somebody with fibromyalgia, it is going to generate a pain signal. And, a simple way to think about this is sort of the princess and the pea phenomenon. And absolutely, that is a significant part of what we're dealing with in fibromyalgia. And I'll kind of go through each one of these types of pain and let you know my favorite ways to treat them. To start with the muscle pain and tenderness, I like treating this with manual therapy like myofascial release, trigger point injections, gentle exercise or movement therapy, gentle stretching, and topicals. So topical NSAIDs, topical CBD, topical magnesium. This is where I think the topicals have such an important role. So those are my favorite ways to treat the muscle pain. My favorite way to treat the all over body aches, the inflammation, is to really do anything we can to lower inflammation levels in the body. So these body aches, the flu-like inflammation that we feel, is really generated by elevated inflammatory chemicals in our blood. These are actually the same type of inflammatory chemicals that are activated when our body is fighting a viral illness like the flu. So it is actually flu-like aching that we are experiencing. But the best way to really reduce this is to do everything we can to lower inflammation. And one of the biggest areas that kind of is modifiable, things that we can do to reduce inflammation, is figuring out which foods we're eating that are generating inflammation in our body. And I recall when I first was dealing with fibromyalgia, one of the initial things that I found that actually gave me some benefit after months of trying different things was when I cut out dairy and gluten from my diet. And within about 2 weeks, I noticed that I didn't have that flu-like aching all the time. And that was kind of my first indication that, there were some things I could do to help myself to feel better, and also that maybe inflammation was playing a role in what was going on with me, even though my blood markers in the standard tests that my doctor was ordering did not show inflammation. And that's because the type of inflammation we're dealing with in fibromyalgia doesn't show up on typical blood tests. I will go into that more in a different video. The final thing, the pain hypersensitivity, the princess and the pea phenomenon, that we need to address differently. So with that, what we're trying to do is with medications, supplements, other kind of approaches, anything that we can do to lessen the pain signal amplification. Basically what's happening is our brain is turning up the volume on any pain signals that we're getting. So there are some medications that help with that. This is actually where things like Cymbalta help. That's the way basically that Cymbalta and similar medications reduce pain. The second thing are things like low-dose naltrexone. That's a very nice anti-inflammatory agent that really works on the brain. So any of those things are super helpful. And I go way more into, there's a whole chapter 19 in the Fibro Manual about different approaches to reduce those 3 types of pain. And then as I hinted at in the beginning, the 4th type of fibromyalgia pain is pain generated from nerves and nerve damage. So we know that about half of people with fibromyalgia also show evidence of damage to their nerves or peripheral neuropathy. We're not exactly sure what causes that, but the nerve pain typically is associated with like numbness, tingling, pins and needles, kind of a deep ache. And that is something that has to be addressed somewhat differently. I'll go over that in other videos. But if you're interested in learning more about how to manage your own fibromyalgia pain, I encourage you to check out the Fibro Manual, and I hope that there will be some useful information there for you. Thanks for joining me. I will see you in my next video, which I won't promise will be tomorrow, but will be sometime soon. In the meantime, stay fierce.